Okay, boys and girls, right now I'm going to explain to you all the different instruments or different tools that the doctor uses at your normal doctor visit or at your normal checkup. First thing we're going to go over is things like stethoscopes, tongue depressors, scales here to check your body weight. We're going to check the ear or the otoscope. We're going to check the thermometer right here. And then also this thing right here, this is a blood pressure cuff. So we're going to explain all those different things in a minute here. The first thing I would like to talk about is your stethoscope. So let's take a look at this stethoscope. Okay, now watch how she's breathing in deeply and she's doing exactly what the doctor says. This little tool here is a great tool, and the doctor uses it for many things. First thing the doctor will do, though, is put this part inside their ears, all right, so they can hear things. And then this end right here will go on your chest, kind of right where your heart is or maybe right where your lungs are. Now, this definitely does not hurt, okay? All the stethoscope does is it feels a little chilly because it's a little cold, but when they put it on your skin, the doctor can then listen to your heart or your lungs. So a lot of times the doctor will ask you to breathe in. The doctor may ask you to do a couple other things like just stay quiet so he can listen to the beat of your heart. But really, the stethoscope is only used to listen to your lungs and listen to your heart. Make sure your heart is beating the right way. Make sure your lungs sound pretty good and all those types of things, okay? So it's nothing to be worried about. It's a very simple tool that the doctor uses, and it helps keeps us healthy. Okay, the next thing we're going to look at here is something called the tongue depressor. The tongue depressor is used for a lot of things here, but mainly what the doctor does, if you look in this picture right here, is the doctor will ask you to open your mouth. He won't ask you to say anything right away, but they'll put the tongue depressor, which looks like a giant popsicle stick, they'll put that on your tongue, and really all it's used for is to hold your tongue down so that the doctor can look right down the back of your mouth and into your throat and make sure everything looks pretty good and everything looks healthy. Sometimes the doctor can notice like different bumps or something. Sometimes they can notice that your throat might be swollen or some other areas of the back of your mouth or throat look like they're unhealthy. So really the tongue depressor is a simple tool just used to see down your throat and to hold the back of your tongue down so that it doesn't get in the doctor's way. Okay, so if you look at this guy right here, it says, so I can make sure your throat is healthy. Really, that's all the doctor wants to do. They're just trying to make sure that the back of your mouth looks good, and they need to hold your tongue down. So it's a very simple thing. Now remember, this tongue depressor should only be used once. The doctor's not going to reuse that tongue depressor. So if you see one that does not have a package or anything like that on it, make sure you're not using those. Make sure you ask the doctor if he's got a brand new one. Every time he uses it, he should use a brand new tongue depressor. Okay, now watch how patient this girl is as she gets the tongue depressor used on her. She does exactly what the doctor says, and it's great how the doctor is wearing gloves. That way you know the doctor's taking care of themselves and the patient. So just watch how this kind of works, and that way you get a great idea of the tongue depressor. Okay, boys and girls, the next thing we're going to look at is the scale. Often at the doctor's office, they want to know how much you weigh, and they also want to know how tall you are. Sometimes they want to figure out how much you've grown over the last couple years and make sure that you're growing at a normal rate, and also make sure that your body is at a healthful weight, okay, for the age and the size that you are. All right, so if you look here, it says that weight is a measure of how heavy your body is, okay? So if you look at this person's feet, you step on the scale, looks like this person weighs 177.5 pounds, which could be a healthy weight, could be an unhealthy weight depending on the person, okay? Everybody's weight is different, no matter who you are, and not everybody's supposed to weigh the same amount. A lot of times it depends how tall you are. Okay, so if we look over here, you see another person who's measuring their height. All right, and you want to see how tall they are. Oftentimes the doctor needs to know this information to make sure that everything is going right with your body. When you get weighed or when they figure out how tall you are, it doesn't hurt, and it usually goes by very, very quickly. So it's something that you just follow the directions, the doctor tells you what to do, and that's it. It's very simple. Some of us may have even had this done from Mrs. Bombas. A lot of times she may check the height and the weight, maybe in the beginning of the year and then maybe once at the end of the year to see how much you guys have grown over the year. So this is a very, very useful tool for the doctor. And again, it doesn't hurt and it can go by very, very quickly. Take a look at these boxers as they get their height and weight checked before their big bout, their big match. Okay, and now the next thing we're going to look at is something called the otoscope. The otoscope is a great, great tool from the doctor's office. Looks kind of scary, looks a little goofy too. You see all these pointing edges and things like that. But what happens is the doctor's going to stick this part right here inside your ear. And then they're going to look through this section in here to make sure that everything inside your ear is working the right way. Okay, they're going to look in there to make sure everything looks normal, make sure that there's no fluid or anything in there that could cause problems with your hearing. It is an excellent, excellent tool. Sometimes they can also look into your eye with this tool as well. Usually there's a big light that shines, and they use the light to look inside your ear canal. If you look at this picture right here, it kind of shows you the otoscope's light, so that way that when the doctor's looking in through this section right here, that they can see all the stuff that's going inside your ear. But they also use this for your eyes as well, to make sure that your eyes are working the right way, like your pupils could be opening the right way and at the right time. But again, this does not hurt. The biggest thing that you have to worry about is staying still, and it does tickle a little bit when the doctor sticks it into your ear. You got to try to stay still and just do what he says and follow directions, and make sure that you're not wiggling around too much. But other than that, this is a very great tool or instrument that the doctor uses on your normal checkup. Watch how patient this person is as they let the otoscope go into their ear, their head stays still, and the doctor can see everything that they need to see. The next thing we're going to look at is called the thermometer. This is a great tool because it measures your body temperature. Now, if you look up on the board, it says your normal body temperature is 98.6, okay? Now, how do we know if our body temperature is at the right temperature? Well, it's simple. We use the thermometer. With this thermometer, you put it in your mouth, just like the little girl's doing in this picture. It has to go underneath your tongue, though, okay? You keep the thermometer under your tongue for a good couple minutes, and I'm sure a lot of us have had this happen. And once you're done, you'll see a little read here, a little printout. If you have a digital one, it'll tell the exact temperature of your body. This is an older one, and the numbers are on the side here. Okay, you'll see numbers here. And all of a sudden, if your body temperature is at a certain temperature, it'll have a line, and it'll tell you what temperature you're at. It's very simple to read. It's very easy to use, and the best thing about it is it doesn't hurt. But this is how we can figure out if our body has a temperature, if it's too warm or too cold. Sometimes we might need some medication or something like that to maybe help bring our body temperature up or down. But it's a very, very useful tool for the doctors or the nurses to use to get a good idea if we're doing well and if our body's healthful. All right, so a lot of times when you go get a checkup, they will test your body temperature by using this tool called the thermometer. With the thermometer, guys, you have to make sure you're sitting still like this little boy is. He's staying still. He's letting the person take his temperature. You can even do it with little kids. Adults also get their temperature taken too. Watch this one adult. She's patient, she's staying still, and she lets them take their temperature. Now let's take a look at this one here. This is called the blood pressure cuff. This is a very cool instrument, also very important thing that the doctor or nurse will use. What will happen is they'll sit you down, or sometimes you may be standing, but they'll wrap the cuff around your arm, right around your bicep or your upper arm, just above your elbow. And when they wrap this part around your arm, the next thing they'll do is they'll take this little section of the blood pressure cuff and they'll squeeze it. As they squeeze it, this part right here will start to fill up with air. And then the nurse or the doctor will be reading this little meter. And as this meter goes up and down and all kinds of movements, they will be able to see what your blood pressure is. Now, your blood pressure can get a little confusing. There's a couple different ways to read the blood pressure and things like that, but the main thing I want you to know is if you eat healthy foods and that you exercise well, your blood pressure should be just great. But this is how the nurse or a doctor tests your blood pressure. What also is important for you to know is when they are pumping the blood pressure full of air, that the cuff can start to feel kind of tight. This part right here can start to get really, really tight on your arm, but just when it starts to get really uncomfortable to the point where you're thinking, man, this might start to hurt soon, that's when the nurse or the doctor will let all the air out. They'll be able to read your blood pressure and give you a number and tell you how healthy your body is, okay? So it's a very, very important tool. And again, it doesn't really hurt. It just gets really, really tight. All right, and if it gets too tight, you just let the doctor or nurse know that it's a little too tight and they'll fix it. All right, but again, this is called the blood pressure cuff. All right, guys, watch this patient get her blood pressure taken here. The doctor does a good job of, being professional and making sure the patient is comfortable. With the blood pressure cuff, you do feel a little squeeze right here when they wrap it around and they start to kind of pump up the blood pressure cuff. Your arm's going to feel a little squeeze, a little pressure, but that's okay. That's normal. All right, so boys and girls, let's watch how this works. Now this one is actually my favorite. This one is called the syringe, or many of you like to call this the needle or the shot. But this is a tool that you might see at the doctor's office, and this is usually why people don't like to go see the doctor, because they're afraid of the needle or the shot, or what we like to call the syringe. Now this is a very helpful tool for the doctor. And honestly, I think this is one of the best tools, and I'm glad it was invented. The reason for that is because before this was invented, when the doctor needed to put medicine in your body so it could work really, really fast, they may give you a pill or something like that. But even with a pill, that takes usually too long. With a syringe, what they can do is put the medicine in this part of the syringe, press down on this button right here, and when they press down on that, the medicine will come right out the edge of the needle, and it goes directly into your body, and it starts to work right away. There's not a whole lot of waiting time. So the syringe can be very, very useful. The other thing they like to do with the syringe is take blood from your body. Now, without this teeny little needle right here, how else could they get blood out of your body? I don't know, a knife or something like that? Man, that would really hurt. So a syringe is probably the best thing. Now, if you look at these pictures here, these are people giving blood, donating blood so that other people can use their blood. This person right here has a big happy face. It doesn't hurt at all. Notice she's not watching. This person's doing a good job. They're wearing their gloves, all right? And they go right on your arm. They put the little needle in there. It gives you a little prick. And then after that, you're fine. They clean it up. They give you a SpongeBob Band-Aid, and everything's awesome, okay? And that way you can still get your blood taken out and help other people. And also the doctor can then look at your blood and make sure that it's healthy blood. All right, so this is called the syringe. It's something that you will see at the doctor's office. And again, it really, really doesn't hurt. Just don't look at it. Look the other way. The doctor or nurse will get it in and out of your body, and everything will be just fine. All right? You guys have done a great job of listening. Let's keep it up. All right, now, boys and girls, in a minute or in a couple seconds, you're going to see a quick, tiny little clip of someone receiving a shot or a syringe. It's only going to last a couple seconds. I guarantee you will not see any blood. And it's going to be very, very quick and painless. And you're going to see how the patient is doing just fine. Actually, she smiles at the end, and she's doing okay. It's a teenager getting shot. If you don't want to watch it, you can cover your eyes and just do this. You can turn your head if you want and do one of these. But if you want to watch it, it's okay. It'll be very quick, and I promise there'll be no blood. Okay, boys and girls, this won't look too bad here. Just keep an eye on how the patient is staying still and doing a great job.